Eric Bakker, the Naturopath. Thanks for coming back and checking out the channel. Let's today talk about an interesting topic. You may have heard this word before, no doubt. You would have seen it, on the internet, read it maybe in a book, and it's inflammation. So what is inflammation? Let's talk about inflammatory disorders and inflammation. I mean, you're not going to really find a society of inflammation or people raising money for inflammation or web pages or people on Facebook talking all about inflammation. People talk about disease. They'll talk about heart disease. They'll talk about diabetes, obesity, cancer. They'll talk about autoimmune disease, all these conditions. And what they're basically telling you is, what they're not telling you is, all these conditions have got one thing underpinning, and that's inflammation. Inflammation is linked within 1 in 5 cancers. If we look at the leading cause of death in women in America and in many countries today, it's autoimmune disease, inflammation, inappropriate inflammation. Now, not all inflammation is bad. We've also got healthy inflammation. Like if we bump our elbow, we get a little cut. A couple of weeks ago, I was pruning my roses, so I get a thorn stuck in there. So, we're going to get a little bit of pain there, and we get swelling, redness, heat. This is all normal inflammatory response of the body designed to counter these injuries and to, repair that little cut I got on my finger. Within 3 to 5 days, it's gone. However, that's acute inflammation. So if you've got a sore throat, that's inflammation. If you've got a cough, that's inflammation. These are all acute, self-limiting inflammatory diseases that everybody gets. A sore back, maybe they'll have a fall off the roof or something or whatever, but there'll be some type of inflammation going on in the body, and it usually means pain, and we've all experienced that. But chronic inflammation is a bit different. This is actually not good. Chronic inflammation can get into a severe chronic inflammatory cycle where your immune system keeps producing chemicals to try and repair a mechanism that's beyond repair. So it keeps producing these chemicals called cytokines, inflammatory mediators, to try and mediate that chronic inflammation, to try and drive it down. But sometimes these mechanisms get broken or jammed. Now, part of the research I look at points towards the gut, like the gut bacteria in bad shape. The host has been compromised and antibiotics have been taken or something, for example. So it's ruined this gut. And then autoimmunity can occur because if we look at diseases like Sjogren's disease now, that's linked with, all sorts of gut problems. And so are many autoimmune diseases like rheumatoid arthritis is linked with certain types of bacteria. So we're seeing more and more of this. One day, I think they'll find that most inflammatory disease comes from disturbances in the microbiome in the gut. So once you get this chronic inflammatory cycle set up, if chronic inflammation, basically your body's trying to counter chronic inflammation by making more chemicals which create more inflammation. So you're on this big cycle, and this is often where pharmaceutical anti-inflammatories come in. And they're big sellers for drug companies. If we look at all of the anti-inflammatory drugs, antibiotics, all the anti-drugs are often created to counter an inflammatory response. Even in the brain, cognitive problems, dementias, anxiety, a lot of these things are linked up with inappropriate inflammation. So this video is just to explain what inflammation is. It's a healthy thing, but when it's chronic and out of control, it's bad. We all have arguments with people, but however, sometimes those arguments can lead to escalations of severe violence and even death. And this is like inflammation. Inflammation's like a short-term argument. We'll recover from it. We'll talk about it, we'll get it sorted. But sometimes we can't talk about things enough, and this is where all this mass murder and stuff's coming in, for want of a better word. So we've got to control the inflammatory response, and that's what we're going to talk about in subsequent videos. This is just the first one to explain what inflammation is, that it can be controlled, it's not bad, and we're going to talk a lot more about foods, pro-inflammatory foods, anti-inflammatory foods. So stay with me. Thanks for tuning in.